Hello and welcome to today's 5-Minute Friday. I'm delighted to be joined by Liana Attard, who is the Multinational Client Leader for Mercer across Asia, Middle East and Africa. And one of the big changes of the pandemic has been the increased understanding of the impact of individuals' mental health. And Liana and I have been talking about how companies and employers have been responding to this crisis in supporting their employees across Asia. So, Liana, thank you so much for joining me today, and just give me a bit of some of the context, some of the background to this within Asia.
No, thanks, Chris. We've really seen an increased focus on mental health. I mean, it's something that should have been focused on by the public sector and by employers, but I think particularly in Asia for years, the concept of wellness has always been around physical health and physical well-being, something that's tangible, can touch, feel, see the risk involved. But we've really seen that shift, particularly off the back of COVID and the pandemic last year, the impact that not addressing emotional well-being and even understanding what those risks are can have in terms of productivity in the workplace, engagement from employees, and their overarching well-being as well. And so we've started to see the role of the employer really shift there and starting to take, particularly in Asia, where social security systems and networks are not like what we see in other regions. The onus really lies on the employer to start to address some of these challenges and work with governments locally too to help address those issues. But we've seen that role of the employer really change, and they're starting to look at things like, at a very basic foundation level, do our insurance policies provide adequate coverage for mental health, or are they inadvertently set up in an unconscious bias type of way? In terms of well-being, to what extent is that being extended to employees? And very importantly, the access to care piece as well for employees, and making sure that appropriate access to care exists. Just to give you a stat, in Asia, it's not uncommon to not have appropriate access to psychologists or psychiatrists, even at that preventive stage, even before you start to get down that sort of clinical support. And we see this even in relatively mature markets in Asia, like Singapore and Hong Kong, still a ways to go.
And so the change which are happening, are they primarily being led by sort of companies feeling like they should be doing the right thing, or is it because they see that actually I'm going to have a more productive workforce if I do address this, or is it about helping to change the brand that they have as an employer?
Yeah, I think it's all of the above. It's all three things. But we've started to see employers as well realize that the gap between what exists locally in terms of publicly available healthcare versus what their employees need around access and even insurance coverage is still quite large in Asia. And unfortunately, we're seeing employers having to really step up in this respect. The recent case in point is in India, unfortunately, where we're seeing the rising cases of COVID. Employers are really taking it on themselves to make sure that their employees have got the appropriate access to care, oxygen. I was talking to a client this morning that owns their own ambulances and is using that to ferry employees, and help provide appropriate access to treatment as well.
So potentially as this sort of grows, more and more companies will see that other companies are trying to do the right thing for their employees, and so you should hope that therefore there will be a continued sort of increase in care being provided by companies, and therefore in sort of equivalent insurance coverage, and so potentially this is quite a big moment in time in sort of a shift in the market.
Yeah, it's really nice to see also employers leading affiliates and alliances together in partnership with the local ministries of health to try and drive some of this change and create awareness too. So I think that's starting to happen, that discussion at that level. And the more forward-thinking organisations are really treating, particularly on mental health, are really treating this in the same way that we have long treated physical health and well-being, where we have occupational health and safety departments set up and where the risk is known and the measures are put in place to prevent it and also address it. And we're starting to see that now on the mental health side as well, what that needs to look like. What are those risks? How do we address them? And how do we partner within the ecosystem to make sure we're not only preventing it, but we have that appropriate access to support and care?
Brilliant. Well, Liana, thank you so much for sharing all of that. I mean, it feels from what you've just said, like actually there could be some real real positives that have come out of the pandemic, and which is great to see. Yeah. So Liana, thank you so much for sharing, and hopefully we can chat again in sort of 6 months or so and see how the markets continue to evolve.
Excellent. Thank you, Chris. Good to see you.
Cheers. Bye.